some good things and you're going to want to jump on board. Some of you know people who would need the services, or you yourself might need the services. And so we're going to have a packed night tonight. And so without any further ado, let me just introduce the folks we have in the studio. My friend, we have Leela here.
Nice to meet you, Dr. Jeffrey.
Leela is the gynecologist, and you'll learn some more about her in a while. And we have a neurosurgeon here, neurosurgeon here in Troy, right? Troy.
That's right.
Troy Anderson. All right, good. So we're going to open the lines in a bit, and you're going to be able to call. And if you have any disease at all, these folks tell me they can heal just about anything. But
I don't know if you're going to make a disclaimer to that. No.
They didn't say that.
I'd be happy to hear your questions.
They didn't say that. In fact, they told you'll hear that there are some things that they can't heal, but they'll tell you who can heal those things. We'll get to that. Amen. Amen. So, folks, let me begin with you, Leela. Ladies first. What are you guys, in essence? Tell me a little about yourself. Who are you, what you do?
So I'm an OBGYN, obstetrician and gynecologist. I had the privilege of being trained at Loma Linda, and I am just so thrilled to be here in this wonderful country. We are here to provide free medical, dental, and even some eye care services to those here who are in this area.
Beautiful, beautiful. All right, Dr. Anderson?
Well, I'm a neurologist and sleep specialist, and a lot of people forget about something so important in their life, and that's sleep. They worry about water, food, nutrition. They forget about sleep. And so I love talking about sleep and giving people a good night's rest. You can call me the knock you out doctor if you want.
Sleep specialist. Talk a little about Loma Linda. Loma Linda. Where are you located?
Loma Linda is in Southern California, and the original name of the Loma Linda Medical School was the Medical College of Evangelists. And so it has a primary mission to reach people's heart through healing.
To make man whole.
That's right.
To make man whole.
To make man whole.
And actually, Dr. Anderson and I both had the privilege of being graduates of Loma Linda University.
Okay. I almost went to Loma Linda.
Oh, really?
Almost. But I was
what did you do there?
I was going to do clinical psychology.
Oh,
okay.
Very
I
nice.
still have plans.
Praise God.
Still have plans.
Well, you're reaching a different type of healing at a deeper level.
Okay. All right. Okay. So, what brought you here to Guyana?
So, first of all, Dr. Leela and I have a passion to help people, and we feel God has gifted us with knowledge, and we want to share it. And so when we heard that the people of Guyana could use some help through the Maranatha, who is our sponsor for coming, and they needed some doctors to fill this spot and some help, we decided to fill it. So one of the primary things we're going to do here is we brought a construction crew to paint and also to remodel the Davis Memorial Hospital. But the second thing we're going to do is we're going to go to the Good Hope community, and we're going to put on a medical and surgical and dental clinic there to help the people of the Good Hope community.
Okay, and that's a Good Hope on the coast. So I have different Good Hopes, so the one is in the coast, right?
Right.
East
at
Coast.
the New Life Center.
At the New
Life
Life
Hope
Center.
Center.
Mm-hmm.
All right, good. And what are some of the things you're going to be doing there, Dr. Leela?
So me personally, I'll be seeing the women, the gynecology aspect. I'll be doing obstetrics if it's necessary. But we also have other specialists. We have, of course, Dr. Anderson. He just talked about the neurology and sleep experts. We also have a pediatrician. We have primary care. We'll be doing surgical procedures. We have glasses that we'll be able to distribute to the patients. Reading glasses, yes. We're having examinations from that perspective. We have a full pharmacy. I mean, the pharmacy is absolutely huge. Of our people that came, we had 35 suitcases we were able to bring of pharmaceuticals and supplies that we can't wait to distribute to those in need. So we've got a lot of opportunities for the women's perspective. We can do pap smears. We also have the ability to take off if you have that mole or that lesion that you've just been bothering you. We can do that for you under anesthesia, and you don't have to feel it.
Beautiful.
So.
Amen.
Beautiful. Folks, you hear what's going on here at the Good Hope Life Center. All of these things will be taking place, and it's going to be from the 18th to the 21st. That's it, from the 18th to the 21st. So if you have moles you want removed, some dental work you want done, pap smears, if you're like me, you have some neurological problems.
I got that.
Now you said that you sound as though you have moved a whole medical outfit here. You talk about the setup. What are some of the equipment you brought?
You know, you have to. Dr. Leila has such a love for the Guyanese people that she has worked tirelessly and endlessly for the last 2 months to build a complete complement of medical equipment and pharmaceuticals. We took over 31 suitcases from America that was filled with amazing medical equipment, some of which worth nearly $70,000.
Wow.
And the sterilized equipment, we have a team of professionals, over nearly a dozen professionals, and we have a team of providers and volunteers to help us. So it's going to be just an amazing, wonderful gift of love to the people at the New Life Center.
You guys work in the medical profession. This is your, not only your profession but your vocation. It seems as though this is what you want to do in life, as though you've met your calling.
Yes.
And based on the equipment and the stuff, the materials that you've brought in, how many people you think you'll be able to see for the duration of the time you will be opened for?
So the hours, that's a really good question, Pastor Jeffrey. So the hours again are from 8 a.m. to 3 p.m. on Sunday, Monday, and Tuesday. On Wednesday, we close at noon. So you're going to want to come early. First come, first serve. So get there early. But we have enough supplies to provide services to about 1,300 plus patients.
1,300 plus. Okay, good. And how big is the team that came? How many of you will be providing these services?
You know, I'm not exactly sure the number. I have to check with one of our people that's in charge of that. I could say that there's probably about a dozen professionals. Now, providers in terms of physicians and dentists, we're going to have, I believe, 7.
But as far as our total volunteers that came on this trip, 54 people came on the trip together.
Wow. 54 altogether. Now, some of those will be doing some construction, but more than half of those will be doing
we
the
had
medical clinic.
We had 32 this morning at the medical clinic.
Yeah.
So some of you, and folks, for you, those of you who may not know, Seventh-day Adventist is building a school in Durban Backlands. And they're going to have 3 buildings in the school compound, and 2 are almost completed, another one is going up. And so some of the volunteers will be doing construction work on that.
That's correct.
And doing some painting and so on. All right, good. Now I'm going to open the phone lines. And if you have a call, you have a medical question, a gynecological question, or a neurological question, or maybe just another question because you think these people look as though they can answer it, you can call, right? You can call in now. You have a pain, you know someone, maybe your mom or dad or something, and you have a question. They're anxious to answer your question, right? So as we go on tonight, we'll also take some calls as we move forward. Now, you're going to be, is this the first time that you guys have been here to do the medical outreach?
This is the first time that we've come together here in Guyana to do medical outreach. Now, we were here about 2 months ago.
Yeah.
Because we've heard about the need here, but we weren't sure what the extent of that need was and the infrastructure and if they could support us. And so Dr. Layla and I came out here about 2 months ago.
Let me interrupt you.
Go ahead.
Because we have a call, right?
Okay.
Hi, good evening.
Hello, good evening.
Hi.
Hello.
Hi, how are you?
I called concerning my dad.
Uh-huh.
He has prostate, and he can go to the washroom like normal. He has to use like something before he go to the washroom, but normally he urine just running out like that.
Oh,
What, he
are
has what?
he's having to? Are you?
The
Is he
urine-
having to to place a catheter in his bladder to urinate?
Yeah.
Okay.
They used to do that when he went in the hospital.
Uh-huh.
But he at home, so they're treating him, but I don't know really what's going on. First thing they say he have to go on a surgery when another will do it. So I don't know, but he had to go and do some blood tests.
So
What's going on again? Because his navel now come out, punch out more big. So they say like he got the hernia too. Never mind, he have the prostate.
yes. So it sounds like he has something called, I can't say it's for sure benign, but it's referred to as benign prostatic hypertrophy, where the prostate gets enlarged and it causes you not to be able to void.
Yeah, it's something like a
Yeah. So they've probably tried.
Yeah.
They've probably
Something
tried.
like it's a blockage there. cancer.
That's
It's
right.
yes, and they probably tried medication in the past. It sounds like they're kind of referring you at this point potentially to surgery. So
Yeah.
you would want to get a specialist to evaluate him if you can. A urologist would be who you would hope to see,
Yeah.
and that's most likely what's going on. Now, of course, you can't. He needs to see a urologist just to get a biopsy as well.
Okay.
Yeah, because the reason why this is
So
so.
the 7 Days Church at
What's that?
Fountain of Love at his goal.
Okay.
So my dad lives not too far from the Hope Center.
Oh,
We
okay.
would be happy to see him. If you would like to have him come by, we would be happy to see him. We have a male provider, primary care provider. We would be happy to see him.
But it's important that you do not delay, because the worst thing is that this could be a representation of prostate cancer.
Yeah,
Prostate
I know,
cancer
right?
that's
So
very
I
well
will bring
treated.
him there, and you guys could see him too, you know?
We
Yes.
we will be happy to see him. That would be wonderful.
Welcome.
Thank you.
Sure.
Okay, beautiful.
God
Thanks
bless
for
you.
thanks for calling. All right, good. So you guys are very versatile. Here you are expounding about even prostate thing. I thought
I'm a gynecologist.
I
Hey, we all
know
had
how
we had to
general
be trained. We had to have general
Yeah, we
training
had
too.
good training. We could diagnose some things like that, but when it comes down to managing it, that's where we will be
Believe
limited.
me, I'm not doing any prostate surgery tomorrow.
Yeah. We could do. I could do a prostate exam. She could do a prostate exam, but
would that be part of the
Yeah, we could easily-
compliment that you're
Absolutely.
offering?
Yes, absolutely, we can do that for sure.
Okay, okay. So what is probably the most intrusive surgery that you can
That
do?
I can do?
In the
On the-
outpatient
I brought
situation?
actually all my instruments from my former office, and so I can actually do quite a number of gynecologic procedures. So we can actually do endometrial curatages.
And in
which
English,
is
what that means?
English. In English, that means I can take sampling of the inside of the uterus. We can do biopsies of the cervix. There's quite a number of procedures that we can do.
And what about birth control surgeries? Can you do any of that?
So we won't be doing any birth control surgeries. However, if a surgical procedure is necessitated, we can consult on that.
How
And there's
about
other procedures,
deliveries
too.
of babies?
Deliveries of babies, if you know what? To be honest, okay, I am not asking for mommies to show up at the New Life Hope Center and deliver your baby. But if you happen to show up, don't kill me, Dr. Troy.
No, not at all.
I actually have 3 birthing kits
Uh-oh.
there. So
She's-
I'm not asking. Do
she's
not show
voicing
up.
But
it.
I am
just-
saying it.
I-
If you are gonna have a baby, you would be blessed to have somebody like Dr. Lewis and her amazing training to birth your child. And
We
she
have 3
is-
sets, so no
She
more
is
than
a
3
professional, and she loves doing it. She does this she's delivered so many babies. She would love to deliver your baby.
Do you count? Do you have a count of babies you deliver?
I don't count anymore.
You don't count them?
Sorry.
So when you stop counting at how many?
After 1,000. Probably.
I don't even
Wow.
remember when I quit a number of years ago.
So you studied at Loma Linda and you also practiced there?
No, we do not. So both of us practice in Phoenix.
Ah,
Yeah, I was in the
Arizona.
Navy for 12 years, and then
Ah.
after the Navy, I started my practice in Phoenix, and I started neurology and sleep practice. And she also practices in Phoenix as well.
And when you were in the Navy, you were medical in the Navy too?
I was a flight surgeon for several years, and then I became the neurologist and a flight neurologist. And then I was also taking care of neurology specialties in the flight arena.
And you were ever stationed outside of the U.S.?
I was stationed in Guam, and really Guam was my main station that I did outside the U.S.
You worked outside the U.S., Dr. Lila?
I've done a lot of mission work outside the U.S., but
Where
never.
are some of the places you've gone?
I've been to Dominican, Guatemala. I've been to Philippines. I've been to, let's see, where else have I been? Several places in South America. So St. Martin.
Ever been to the Caribbean?
I have been to the Caribbean. Yes, several times actually. St.
But ne-
Kitts.
Never Guyana.
No, not well.
You
Actually,
said- you
6
said-
weeks ago. 6 weeks
Yeah,
ago.
before.
Yeah,
right,
before to
right.
set it up. But also I wanted to mention, besides the OBGYN procedures, there's also minor procedures that will be happening at the New Life Center, New Life Hope Center. We will be doing biopsies, and we can drain abscesses. And so there's lots of different things
There's
we
a
can do.
lot of things that we can do, and again,
Besides
we've got tons of anesthesia. So I mean,
Any hernias? Umbilical
we
hernias?
won't be
No,
doing
that's
hernias.
too
It
remote.
takes more anesthesia than just a little local
Oh, so
anesthesia.
just local anesthesia?
Yeah,
That's
that's
right.
what we'll be offering is local anesthesia. But there's a lot. I mean, people will be surprised. People who aren't medical are surprised how much
Yeah.
you can actually do under local.
Okay, Doc, talk a little about some of the training. You said that you'll be providing some training to local, is it local, just medical personnel
That's right.
or doctors?
So mostly doctors, you know, I want to teach, it would be a blessing.
Remember I asked you
Yeah.
that question, what kind of training? We have a call, okay? So let's take a call.
Okay,
We'll
sure.
come back to that.
Okay, sure.
Hi, good evening.
Hi, good evening. I recently had
Can you speak a little louder, please?
I recently had a blood test, and it was shown that I have high
Cholesterol,
calcium. Would you tell me if that
Calcium?
is, yes,
Or calcium?
what is the meaning of high calcium?
Oh. Well,
Go ahead.
you know, high calcium is interesting. The bone is really interesting. It really does adjust your calcium levels. But a high calcium level could be your diet. There's just a lot of meanings of why you can have a high calcium level.
You should
Yeah.
check
Go
your
ahead.
we need to check your parathyroid.
Absolutely.
You need your PTH, your parathyroid hormone checked.
Mm-hmm.
You would want to, you know, that's one of the first things that you think about. Sometimes the thyroid can interplay as far as the calcium is concerned as well.
Mm-hmm.
So an examination, a simple examination, can at least elicit whether or not you have an enlarged thyroid and perhaps parathyroid. You don't usually feel the parathyroids on examination. The biggest thing is going to be getting blood tests done. So further blood tests would be the next step for you. And most likely it's just an entirely normal thing. You can have a slightly elevated lab value and it doesn't mean anything. So it's just it's a process. I mean, it depends on what the lab value is. So if you'd like to come to the New Life Hope Center, bring your lab results. We can take a look at those with you. And we can, between the examination and looking at your old lab results, we can sort of figure out and give you better recommendations.
And we can do an examination to look for
Absolutely.
enlarged thyroid that will
Yeah.
help.
Okay.
Okay?
Does that help?
Thank you very much.
Thank you so
Thank
much.
you.
All right, we have another call. Hi, good evening.
Hi, good night. I'm calling in to find out about polycystic ovaries.
Oh, that's
Polycystic,
perfect.
what
That's
would she
right.
say, PCOS?
Yeah, polycystic,
Polycystic
ovaries.
ovarian syndrome. Okay, yes?
That's right up, Dr.
Yes.
This is
So it
specialty.
does it have a cure?
Yes, there is a cure for PCOS, and you are going to want to come to the evening meetings in addition to coming to see me in the clinic.
That's true.
Okay, and where is this located?
The New Life Hope Center
In good hope.
in Good Hope Community.
Okay, all right, thank you.
Thank
All right,
you.
so you
We'll
just
see
catch
you
a bus and come
there.
up there. All right, good. Now, there are some tests, docs, plural docs. There are some tests that persons can have when they come. But there are some fasting things. They have to do some tests. Persons have to fast. And
Are
so
we
on.
offering
You
that?
doing any
Fasting
cholesterol
cholesterol
tests?
or
Or
glucose?
We're actually we're offering glucose. We're offering some AccuCheck, some glucose
And-
testing at the New Life Hope Center. But the remainder of the tests, they're a little bit more specialized. We want to make sure that they would be followed through. So we're not offering, but we are
any
offering.
cholesterol tests?
No, we're not offering cholesterol tests, but what we are offering is pap smears, so patients can come and get that taken care of, and like we already talked about, the biopsies.
For the pap smears, are there any prep work that has to be done by
No,
the
just
woman?
if you're on your cycle, we won't be able to do the pap smear. It'll be an inaccurate
And what about
results.
intercourse?
No,
That don't
doesn't-
affect it?
No.
Okay. All right. So you were talking, Doc, about the training that
That's correct. So it would be a blessing if we could teach the physicians in Guyana how to take care of sleep cases. Because I'm only here one day, and I'll be seeing some sleep patients. But I want to teach the physicians in the area how to take care of patients that have sleep issues. The most common issue is insomnia. And nowadays, there are so many people that are suffering from insomnia because of their abnormal behavior, the things that they are doing, which are counterproductive to them getting a full night's sleep. You know, with the now with the internet and with social media, we can work and work and work, and it could destroy our ability to transition.
we'll
to
talk some more
relax
about
to sleep.
Hold
Okay.
on.
He's my sleep doctor, by the way.
That's right. But
He
she's a
knows.
bad patient.
I'm a very bad patient. I'm a very
She's
bad patient.
non-compliant.
Yeah.
Hi, good evening.
Good evening.
Hi.
I just tried to find out why you cramping in your pelvic bone and your hips and your feet. What is the cause of it?
You're having cramping in your pelvic bone, is that what you said?
Yes.
In your pelvis behind your pelvic bone, or is it the pelvic bone itself that hurts?
The pelvic bone itself is cramping her.
Okay, if that's a hard one to answer, I would prefer an examination. As far as the pain in your pelvis, there's a lot of things that can cause that. If the bone itself is hurting, that could be a totally different source of pain. So if the pelvic organs are painful, then we can help to analyze that just by an examination and a pap smear. So I would recommend come to the New Life Hope Center, and I'll be able to assess you and some of our other colleagues as well.
Oh,
Okay. All right, thank
Okay,
you so
thank
much.
you.
All right, we have another call. Hi, good evening. Hello?
Hello?
Yes, you're on.
No, I'm sending them to you.
Good evening.
Good evening.
I'm calling to ask if you can direct us where this Good Hope Center is.
All right. Now, I don't know exactly where it is, but I understand that if you're traveling, well, you can get a bus, right? You can get a bus. You can go to the bus stand and just ask them for a Good Hope bus, and they'll get you there. But if you're driving, I understand that when you get into Good Hope,
Yeah.
there is a tower. There is, I think, the GT&T tower or Digital tower.
Yeah.
And you make a right at that tower and go south along that road and ask anybody for the center, and they'll be able to direct you. I don't know. I'll be going though because I need to get some of this good old stuff that is I understand they brought vitamins and stuff like that. So all of us will meet up
you
there.
know, Pastor, there's going to be signs.
me.
Wait, hold on. Yeah.
What days? What days they have there?
From Sunday the 18th to Wednesday the 21st of
Okay,
this
thank
month.
you.
Okay, and on Wednesday, they're only going until noon. So it's from 8 to 3, Sunday to Tuesday, and from 8 to 12 on Wednesday. Okay?
Okay.
So please
thank
make a
you.
note of that, right? All right, good. Thank you. Yeah, you were saying, because I'm saying that I'm coming to get some of this, all this nice stuff and interact with some of other team members and so on. It seems as though you guys will be having a party.
Yeah, we're going to have
It
a
is gonna be
party.
a party.
Come join the
It's going to
party.
be a celebration of health and life.
Yeah, and there's so many good things.
Beautiful.
That's right.
I hope you brought cookies. All right.
No, we
Hi,
we
good
didn't.
evening.
Hi, good evening.
Hello.
I just wanted to find out. I have some problems. Is this injector?
Hello?
Hi.
Hello?
I guess you pressed the wrong button. Okay. So how long have you been doing this, Dr. Lila?
Well, I've been at OBGYN. I finished residency in 2009. So I've been
Okay.
practicing since then.
Okay.
And as far as
person.
mission work,
You're
you're
young.
so
You're-
funny.
she's a young one.
No, as far as mission work goes, I mean that's actually I would say that's both of our passion. I mean I can't speak for Dr. Anderson
Absolutely, I
specifically,
agree.
but I think that being a physician is a blessing from the perspective of you get
Amen.
you get to actually treat the whole person, not just the physical and the mental and
And
emotional.
we'll talk about the
but
spiritual just now. Let's
That's right.
take another call. Hi, good evening.
Hi, good evening.
Mm-hmm.
This is the program with the doctors, the TV, the calling program.
Yes, correct.
Yeah, I'm just trying to speak to Dr. Lewis.
Okay.
Okay.
Good night, Dr. Lewis.
Hello. Good evening.
Yeah, this is Abby.
Hi,
I'm
Abby.
calling I have some problems. I have a fibroid, and I just get a lot of pains. But I took an ultrasound. I took an ultrasound about a month over, and they said that I have the ultrasound results show that I have a mass.
Okay. Is the mass? Did they?
I'm a patient at the gynae clinic at the Georgetown Hospital.
Okay. Did they tell you if the mass was in your uterus or is it in your ovary?
It's between the uterus and the ovary.
Okay. Okay, so this is what I would recommend, especially when you're having pain, is you need to get a surgical procedure as soon as possible.
Yeah, but I normally go to the gynae clinic, but I gotta go to the go until the 18th. But I had a pap smear at the Cancer Institute last month.
Okay.
Second of last month, but I ain't get through with the results as yet.
You did not get the results of your
No,
pap
I ain't get the
smear?
results as yet.
So
Just get a lot of abdominal problems, plenty.
yeah. So I would be happy to see you in the clinic. We can do another pap smear for you for free. In the meantime, you know, by all means, keep your appointment. You said it's on the 18th. I think that's what you said, the 18th? But
They still up the East Coast, you gotta come.
sorry?
Yes, for this outreach, yes.
yeah, so you definitely, no matter what, you don't want to skip out on your appointment.
Medical outreach.
Yes, but the doctor is telling you that you need to follow up with your personal doctor
Well,
right now.
that's what I'm saying. I just go to clinic.
Okay.
I just go to clinic, but by a seat on the TV, I just want to know if I could get some further help.
Absolutely. We'd be happy to see you. We would be happy and honored to see you. Just bring your results with you. Bring your...
Because I just take a copy of my past tests that I took.
Sure.
Make a copy of it.
Yeah, bring your medical records that you have, and I'll be happy to do a consultation for you.
So Sunday will come on the 18th. They still up the East Coast, you gotta come.
Yes, good hope.
But whatever you do, don't skip out on your other appointment.
No, I do not. I went to clinic last month.
Okay.
Good.
Okay. Well, we'll see you soon. That will be wonderful.
Okay, sweetheart.
Okay. God bless.
All right, blessings in you. So, Doc, you were saying, how long have you been...
Well, I graduated from Loma Linda in 1993.
Okay.
Yeah, and so then I joined the Navy, and I worked in the Navy as a flight surgeon, and then finished my neurology training in 2003, by the time I had a chance to specialize in sleep.
Okay. And so, as a part of your... Okay, I'm going to ask a question. Let me take another
That's
call.
okay, no worries.
It's
Take
fine.
your time.
Hi, good evening.
Hi, good evening. Good evening.
Hi.
Calling from Triumph.
Yeah, you need to lower your TV.
Okay, I will lower it. Just give me a minute.
Yeah, all right, take your time. You're on.
Yes.
Thank you.
Hello.
Hello.
Hello?
Yes.
Go ahead.
Hello.
Go
We're
ahead.
here.
Uh-huh.
Procedures here.
Calling it you. Hello.
I think she pressed the wrong button. Your neurological studies.
That's right.
Does it include mental?
So, neurology includes stroke, Parkinson's disease, migraine headaches, multiple sclerosis, seizures, and those are sort of our main things that we take care of. But my subspecialty is sleep, but I take care of all of it.
Okay.
So I do neurology and sleep as well.
Maybe you could remind me of the problem I have.
Okay.
I was in I took a team to Nicaragua.
Yes.
From Augusta. I was in Augusta, and I took a team to do some evangelistic outreach in Nicaragua.
Yes.
And a neurosurgeon was on the team, Dr. Sangster. Not Sangster. Sangster is local. I'm getting a call. I'm a little distracted. Hold on.
Okay,
I want to make sure we get in all the calls. Hi, good evening.
Hi, good night. I just called just now when you tell me to lower my TV.
Oh yeah, you pressed the wrong button. Welcome back.
Okay, good night. I have a stomach problem.
Okay.
Whenever I eat anything, I get terrible pain in my stomach. But I went to the doctor and they gave me some capsules. And I drink it. They said drink it an hour before you eat.
Yeah.
Still, I'm not getting any results from that.
Is it liquid or is it a pill?
It's a capsule, a little capsule, the little ones that shaking inside.
Do you take it every time you eat or only once a day?
No, I take it every day, one time.
Okay. Okay. So did they do a scope? Did they look inside your stomach?
No, they did not.
Okay. Okay. Did you want to answer this, doctor?
Well, this is again up your alley because it's always like the stomach and
Okay.
it looks like
Okay.
there's a lot of big need for you, Dr. Lewis, here amongst the
So it
female
sounds to me
population.
like you may have a little gastritis, which is stomach. It just means stomach irritation or inflammation.
Yeah.
So they probably have put you on some sort of antacid, whether that be protonics or there's many different kinds. So what I would say is, why don't you bring your bottle that they gave you, the medication that they gave you, bring your prescription. We have tons of medication. I can give you all kinds of different things, but let's examine you. Eventually, if it didn't go away after one more treatment of medication, you need to go back and see a gastroenterologist, and they need to do a scope of the inside of your stomach just to make sure you don't have an ulcer or something else in there. Okay?
Thank you so much.
Thank
Okay.
you.
Thanks for calling.
Okay.
All right.
Bye.
Yeah, Doc, I was telling you, the doctor's name was Stankus, and he served in the military too.
Oh, really? Okay.
Since I was in secondary school, I didn't spend long in school, but the few days I went to school, I was doing a test, and I came out after the test, and I have these needles like stick in my temple. I feel like needles
that's
sticking.
called ice pick headaches.
Right. And then they go away. I can't tell you when they'll come. It lasts like a half a minute or so, sometimes just a few seconds, and it's very intense. Ding, 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 ding. Then they just go away. There's no residual pain after it. There's nothing that says it will happen. And then when it's finished, it's over. And he told me the name of it and told me that they couldn't cure it because they can't preempt it. So I have to live. What causes that?
So let's talk about headaches for a second. Headaches are
before we headaches, right? I'm getting another call. Okay, good. All right. Hi, good evening.
Hi, good evening,
Doc. Yes.
Yeah,
Okay.
hello, good
Having
evening.
Dr. Lewis, another
No,
lady.
no.
That's another lady. There's a big need for
Go ahead.
women's health here.
I just come in on the TV program.
Yeah, talk a little louder, please.
I just come in and I see the program
Okay.
and I still calling.
Okay.
Getting a serious back pain and a tummy pain and a knee pain straight down.
I
A
can't
back pain
understand.
and a tummy
and
pain.
the other
You, I'm getting a bad reception. You have us on speakerphone or something?
Pardon me?
Okay, good. So I'm not hearing you. You have a back pain and tummy pain and what else?
And a knee pain.
And a knee
knee
pain.
pain.
Okay, you're fully pained. All right. So
Serious knee pain.
Serious pain.
This pain in me and it swelled. And I went to the hospital and they took an X-ray and they said the X-ray shows nothing.
that's of the knee or the back?
The knee.
Okay.
Some tablets and I'm using it and the pain is still there.
Does it help? Do the pills help?
No, because I got many heavy pain and I drinking it and it didn't help in me.
I'm going to
Does
ask
it-
a couple of questions here because I got to find some neurology, Dr. Lewis. All right, so does your back pain, does it shoot down the leg at all?
Pardon me?
Does your back pain shoot down the leg?
Yes, the back pain is straight, the back straight round the tummy.
Does it seem like it's an electrical shooting pain down to the knee?
Yes, and it comes down straight down to the knee.
And do you feel any numbness or tingling? Kind of like when you hit your funny elbow and you kind of feel that tingling. Do you feel anything like that?
When I sit down long or when I get up, there's the pain hurting me at the back straight to the knee.
Let me ask you, how old are you?
I am 64 years.
How old?
Yes?
64.
60. Or do you do a lot of manual labor, stooping?
I didn't get you there.
Do you do a lot of manual labor like stooping and bending over?
Yes, I'm doing a lot of sweeping,
Mm-hmm.
sitting.
Do you have any problem with weakness of your leg, that leg at all? Do you feel like that leg gives out when you're walking up and down stairs?
Well, I can't climb the step. I can't climb the step at all because if the step is high, so climb up the step. When I reach up, I get the pain. I have to step.
I see.
Long when I do get up, there's pain in me.
So there's a couple things that that could be going on there. One thing for sure, you could have some arthritis, but because of the way the back and the knee pain are connected, there could be a nerve pain, and so you could have a pinched nerve that goes from the back down to the knee. It's important that we look at that because if there's weakness, then things need to be done because the weakness could eventually become unrecoverable. So again, I could see you. I'm going to be doing a neurological consultation there, and I could see if this is a nerve pain, and then also the primary care doctors can see if this is a joint and a joint issue.
So
Okay.
specifically on Tuesday.
So
if you
try to
want
come.
to see Dr. Anderson, come on Tuesday.
Okay?
From where? Where?
You're coming to the Good Hope Center? Good Hope Center?
New
New
Life.
Life Good Hope Center in Good Hope?
In East Coast.
Yes, thank you. All right?
Okay then.
Thank you.
Thank
Let me
you.
take another
Bye-bye.
call. Hi, good evening.
Hello?
Hi.
Hello?
Uh-huh.
Hello, brother.
You
Hello.
turn
Hello.
down your TV a little, please.
Turn down the TV.
Yes, thank you.
Just a minute. Good evening.
Good evening.
Hi. Is it low enough?
Yeah, we'll work with that. Go ahead.
Yes, I have a problem here. I've been to the doctor during the week. I find that my whole body in pain. All my elbows, my fingertips, everything is just hurting. The doctor told me that I have arthritis pain. But I don't know. I don't think arthritis pain will make you so mashed up. It just feels like if every piece of strength coming out of my limbs.
Doctor, that might be sleeping. That might be right up your alley there.
It could be sleeping, but you know, because she has pain all over, there's a couple of things. Number one is she could have arthritis, and arthritis comes in many forms. One form of arthritis is wear and tear. Another form of arthritis is something that you can get, like rheumatoid arthritis, which tends to be a little bit more severe than that.
I have been troubling with the stomach pain.
Yeah.
So I am.
Are they giving you ibuprofen to take? Are you taking ibuprofen or?
Oh no, they haven't given me that. They give me some kind. Oh, they told me I have stones.
Kidney stones?
Yes, and that they give me some tablets for it. But when I drink the tablets make me feel more bad. It burns my stomach whole day. I can't
she's
drink
taking.
them.
She's on an
Some
NSAID.
sort of NSAID.
Okay, so here's my thought. It sounds like you're on a medication. They're giving you a medication to make your pain more controlled, but one of the side effects of that medication is it can cause stomach irritation, and that can cause other problems, even ulcers. So
Oh, I see.
yeah,
That's
so
right.
Yeah,
so-
but I stopped drinking them because I don't know. It burned my stomach very bad.
Right. So here what we would suggest to you is, why don't you come to the clinic, come to the New Life Hope Clinic. We can examine you, we can examine your joints, we can also examine your abdomen and see if you have something that it seems a little bit more concerning, like you need to see a gastroenterologist sooner.
Oh,
If
all right.
if you don't, we can give you some other medications, but even better than medications, we can give you all kinds of lifestyle methods and actions that you can take that are very simple, that you can actually help to overcome your arthritis, that can help your pain control, and then you don't get the side effects of the NSAIDs.
Okay?
Okay?
Very much.
So try and come,
Thank
okay?
you.
Right, blessings. All
Bye-bye.
right, we have another call. Hi, good evening. Hello?
Good evening. Good evening.
Uh-huh.
I have arthritis. I'm 65 years of age. My legs are bowed, but my pain sometimes is very unbearable. I work and I have to climb stairs, which I do. I climb the stairs, I go up and so on, do my work. But the arthritis pain is very unbearable. And the thing with my arthritis, it gets my knee area and up my leg gets stiff,
Yeah.
very stiff. I don't like ibuprofen because I know the side effects of it, but for the last 3 days, I had to resort to some ibuprofen because
Is it worse in the morning when you first wake up, or is it worse after you've been up for about 30 minutes or an hour?
in the morning when I wake
When you
up,
first wake up.
tablet.
Uh-huh. So it's probably most likely autoimmune related. So the really good news is we can tell you all kinds of, like I was telling the other caller, some amazing simple lifestyle changes that you can incorporate into your lifestyle that can help to get your pain under control. In addition to that, things that are really helpful is if you use some sort of a not hot, but warm, very warm compress at nighttime when you go to sleep. So if you don't have a heating pad, you can get, even if you, worst case scenario, you get a water bottle and you put hot water in it. Don't scald yourself, but put nice warm water in it and put it over your knees. That can help as well. But there's a lot of other things that we can tell you, so I would recommend come to the New Life Hope Center and we'll give you more information.
Where is it located?
Okay, it's in Good Hope. Good Hope. If you drive in, you get into Good Hope and make a right by the antennas there, the GT&T antenna or the Digicel antenna. You make a right and go south.
Yes.
On the road there. If not, you just go to the park and get a Good Hope bus.
Okay. What day? So
From Sunday the 21st to Wednesday the 20.
The 18th.
From Sunday the 18th to Wednesday the 21st.
okay, I'll try to get it. One thing more for the doctor. My daughter-in-law mother, she's diabetic, and she started crying out for a pain at the bottom of her feet.
Yes.
And this pain, I started to be because I look at the TV, I see the talking something about diabetic ketoacidosis or something, and the kind doctors will know. Could you give me some advice? What could she do?
So this is neuropathy, and unfortunately, neuropathy is damages at the end of your nerve. So there's a couple things we can do.
Yes.
But there are some good treatments that you can do at home. One thing is to implement a good stretching program. So you should stretch about 10 to 15 minutes every day, every morning, and that stretching of the nerve stimulates the nerve to repair itself. The other thing you could do is make sure that you supplement with vitamin B12 and folic acid. And then finally, I brought some medications that could help ease the pain as well if you come and see us at the New Life Hope Center.
And again,
Okay,
if
that
you're
is
going
on the 21st.
Yes, I
would
will
be
be
the
on Tuesday. I'll be
20th.
there. What day?
20th.
The 20th. I'll be there the
On the
20th.
20th.
Okay, so tell her to come. I'll take another call. Thank you so much. Blessings. Bye-bye. Hi, good evening. Good evening. Hello.
Hello?
Hi, your TV.
Hello?
Your TV. Your TV is competing with me and you. You on? Can
Where
you turn on
exactly
your
is Good
TV?
Hope?
Oh, where's the good hope?
Can you? Your TV is.
Hello?
He
Your
wants to
TV.
know where it
Yeah,
is.
your TV is done. Hello.
Yes, where exactly is Good Hope?
I can't tell you. I know it's on the coast, and if you're driving, and you were to get on the railroad, the embankment, just ask pull over at any of the shops and ask any of the persons that you're going east along the embankment where is Good Hope. I can't tell you. I'm going to find it though.
Is it after BV?
I can't tell you, sir. I'm very sorry. I know I passed Good Hope several times, but to tell you if it's before BV, after Buxton, can't help you with that. Maybe some good caller will call in and tell us. But make sure you get
Same
there.
area.
Yeah, somewhere on the coast. You won't get lost. If you get
Not on the main road. It's not on the main road.
no, you gotta get on the
the
rail line
train line.
embankment, right?
Okay.
All right, buddy. Blessings. Thank you much. Hi, good evening. Hello? Okay. All right. Yes, Doc, you were telling me about headaches.
So there's two types of headaches, right? There's headaches that are because of secondary to something. Those are the most important ones we have to rule out, like brain tumor, problems with thyroid, things like that. And we can rule that out by some simple tests. But there's another type of headache, which is the primary headache. These are headaches that are occurring just because the way the nerves and the blood vessels work together. This is that type of headache. So this is in that subset of a primary headache disorder, meaning, first of all, it's not going to kill you. You're not going to die from it. It's not going to it's not going to cause you to have injury down the road. It's an ice pick headache, which means the pain is the problem.
Okay.
So this ice pick headache is exactly that. It's sharp. It's very quick. It doesn't happen. Sometimes it can happen in clusters. Then you can go through a period of time where you're not having it.
Correct.
And then, the most important thing is a couple things on that, what I can offer you.
Keep going, Doc. You're on. Hold a while. Let me just get this answer. Okay, the person.
Sometimes, it could be the temperature. So I've noticed in my patients, they can be induced by cold, so wear like caps or a hat. It can be induced, like I know that you look like you shave. It could be something with that or during that time when you shave, or maybe you're putting something on. There could be things that are instigating that. So just things are those are some of the things to consider.
Yeah, but I was having it for many years, so I know it wasn't going to kill me. I would have made long days, right?
Yeah.
So that's good news. Hi, good evening. All right, sorry for that. Hi, good evening.
Hi, good evening, doctor.
Hello.
I'm calling to find out what we call these cramps in the night. I'm always getting cramps. And then I have to jump off the bed in my sleep, and then most of my toes, especially on my right foot, it's kind of sprawl my legs with veins. It would all be knotted up and paining a lot, and then it would take like 5 minutes before, it come back normal. So I don't know if you could shed some light on that and explain what is really happening.
So are you getting leg cramps at nighttime? Are they waking you up from bed?
Yes.
Okay. Well, that could be several different things, like Dr. Anderson, but it could also be something very simple, like Dr. Anderson, like an electrolyte abnormality.
It could be.
So
Yeah, it could be. But there's, depending on her age, she could have some neuropathy. It could be a form of neuropathy. You could have, but the most important thing is electrolytes. That's so far the most common electrolyte issues and dehydration.
it sounds to me like one more person that needs to come in and get
so
seen.
come to the clinic, okay?
Okay.
How much time do we have?
All right, I will. Thank you.
Thank you so much.
I'd
All
like-
right.
I'd like to
We
bring
can
a
get to
different
that.
area up.
We can get to that. I know.
Yeah.
Me too. Hi, good evening. Hello? Hi, good evening.
Yeah, good evening.
Hi.
I'm trying to find out because good night to everybody again. I wake up sometime at night. If I go to bed at 9, I would wake up like 12 o'clock on the dot and would hardly sleep off.
Yeah. So you go to bed at 9 o'clock and you sleep well, and then you wake up at 12 o'clock? Hello?
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 I think we lost
Yeah,
him.
I think.
So, I mean, I'm not sure I got your question right, but a
Yeah,
lot
that's
of
what he
people
said.
have that. They have a hard time maintaining. It's a different type of insomnia. It's difficulty maintaining sleep. And a lot of times what happens is patients will toss and turn all night. This is what I recommend for you. If you get up in the middle of the night, after 10 or 15 minutes of tossing and turning, get up and leave your bedroom, and then maybe kind of relax your mind, maybe have a light snack, and then I want you to think of something like a pleasant memory, or come up with a pleasant picture. Look through your album, your pictures, and think of a picture there, or go through a traveling, a beautiful scenery. And then when you go back to the bedroom, I want you to try to remember that memory like a movie in your head over and over again. What it does is it distracts your brain, the frontal part of our brain that keeps our brain active and thinking. It distracts that brain from thinking about those things and help you relax. The other thing you can do is get a noisemaker. Getting a noisemaker like a fan that make loud noise, or you hear this hum, it's very soothing to the brain, and it blocks out noises inside the environment. So those are just a couple tricks if you have problems maintaining sleep. But don't forget, if you're drinking alcohol, alcohol will put you to sleep at the beginning and then cause you to wake up at the end. Alcohol and medications could be a big reason why patients get up in the middle of the night.
Thank you. All right. Hi, good evening.
Hi, good evening.
Hello.
Uh-huh.
I'm getting some cramp in my hands. The fingers, like if I hold something. My phone also, I'm getting cramp in my hands.
You know, one of the things that you could suffer, which is very common that I see here a lot, is carpal tunnel syndrome. And patients will have weakness and numbness in the hands. And carpal tunnel syndrome, the most common reason why patients get that is because they sleep on their hands and on their wrists. So one of the things we can do is sleep properly. We sleep so we're not sleeping on our wrists, our shoulders, our hips, and our knees are all aligned. Our spine is in alignment. And then our hands are out. One of the things you can do is get a brace that protects the wrist so you're not sleeping on it. But some of the tricks of that is you need to come in and we need to see if you have this. Because if you don't have carpal tunnel syndrome, you could have something like arthritis or something else. And so either me or one of my colleagues can figure out first what is it, and then second, manage it. Probably, more than likely, that this is going to be very easily managed. We just need to know what it is.
So what if a person does have carpal tunnel syndrome?
So what day I could come in?
Any day.
Come any day, starting on Sunday.
Okay. all right.
Sunday,
So you
Sunday to
got the
Wednesday.
days, right?
Sunday to Wednesday.
Okay.
And you got the location, right?
Yes.
What's the location?
Good hope.
Beautiful.
Beautiful.
You're a good student, straight A.
Yeah.
All right. What if a person does have carpal tunnel?
So the thing about carpal tunnel...
Caller, you on. Just hold a while for me. Go ahead.
The most dangerous thing about carpal tunnel syndrome is if you ignore it and you start getting weakness of your hand, that weakness could be unrecoverable, meaning you'll never be able to get your strength back. So you got to take care of it right away.
So you have to do the operation?
Well, you can
No.
do injections before that. But even before that, carpal tunnel can be prevented
So
if
you guys can diagnose
won't-
for that?
We can diagnose, but we can't
You can't
we
treat
can't
it.
surgically treat it.
I can give a shot to help it, but that would just be masking it. We want her.
And
to
so
have
what is
surgery.
the what would the person have to do?
So prevention's the most important thing. You
No,
gotta
and
wear
now
a
that
wrist
if
brace.
they have it, what
That's right.
do they do from there? If
So
they-
wear a wrist brace. The majority of people, we can avoid operation if you wear a wrist brace.
and does it heal itself?
It will. Yeah,
For
that's
example,
right.
you know,
It
Dr.
will.
Troy, in pregnancy, carpal tunnel syndrome really
That's
does
right.
go up. And part of the problem with that is it's a hypervolemic state. So the more volume you have, it actually compresses the nerve more. So
By
Okay, so
sleeping well, getting a
brace.
wrist brace, and you can really recover by itself.
Okay.
Yeah.
Hi, good evening. Hello? Good. Doc, now, we left the best for last.
Okay, let's laugh. No.
In addition,
In
to,
addition
the
to that.
medical healing of the body,
know.
you guys are going to be doing something fantabulous.
Now I have to tell you, you guys know that we are physicians and we love what we do, but we are limited. We can't take care of it. There are, as you know it yourself. There are diseases out there that we can't cure. I can have 2 patients with multiple sclerosis, 2 of them. One patient can be empowered and can do amazing things with that multiple sclerosis. One patient can be so debilitated. What is the difference? One patient has something that we want to talk to you about at nighttime. So at nighttime, we're going to give you the secret of how you, no matter what you're going through, what disease process you're going through, you can overcome your weaknesses and your illnesses. And that's the most important thing, because all of us on earth are dying. Every single one of us are. But, you know, all we can do is help you and guide yourself to help live a life without disability. But eventually, there are people there that can overcome their weaknesses and their illnesses, and we have the secret for you. So, in addition to the daytime, Dr. Lewis, what else can we do?
Dr. Troy, you know, at 6:30 at night, let's just say they're working, right? I mean, they're working. They really wish they could come during the day, but Pastor Jeffries, they can't. Well, the good news is, Dr. Troy, they could come at 6:30 at night, and they can learn these principles that you're talking about right now. So again, it's from 6:30 to 8 p.m. That's also at the New Life Hope Center. So they're really not going to want to miss out on this wonderful opportunity.
Yeah, and we're going to be giving health talks that night. And in addition to health talks, you're going to learn the secret how you can overcome your illnesses.
Beautiful. Beautiful. I like that. We'll talk some more about that. That's right up my alley, Dave.
That's right.
Hi, good evening.
Good evening.
Hi.
Good evening. I would like to know why when I wake in the morning, my throat is bitter.
Oh.
Is it the result of high cholesterol, which is
Her throat is
Oh,
what?
I think
not up now,
Throat is
or
what?
is it H. pylori?
So there's trouble. You're right. It could be something like that. When you lay down at night and you're sleeping, you could have something called a hiatal hernia, where the gastric contents go into the esophagus and cause esophagitis and pain. But if your throat is hurting, one of the things that I get concerned about, I'm a sleep doctor, is sleep apnea. A lot of patients, when they lie down at night and when they sleep, their muscles in their throat relax, causing the airway to close. And so you're basically choking. And the problem is that you're unaware that you're choking. And if you're unaware of that, your oxygen level drops. And if your oxygen level drops, you're at risk for heart attack and stroke in the middle of the night. In order for the brain to save your life, the brain needs to wake up and open your airway. And that process goes on over and over. The brain wakes up, it falls asleep, the airway closes, you choke, the brain senses a low oxygen, it wakes up, and that process could cause the throat to be irritable. One of the things I want to ask you is, are you tired in the daytime? Have you noticed that over the last few years you developed problems with being
In the
sleepy in the day?
daytime.
Some of the time?
Tired in the daytime.
You are.
I'm sleepy.
That's right. So if you're tired in the daytime, do you snore?
No, I don't.
Has anybody ever seen that you have a problem with struggling to breathing when you're sleeping?
No, I never heard about it.
Okay, well, I'm not sure, but one of the things we get concerned about is something called sleep apnea. And in that case, there's things you can do. You can sleep on your side, but I should take a look at you as well. You should come to the Good Hope community, and then we can take a look at you and try to figure out what's causing this.
All right, I will do that.
All right. Thank you much.
Thank you.
Okay. So, Doc, who is going to be this evangelist that will be speaking at these health seminars?
Pastor Sorovic.
Yeah, Pastor Sorovic. Pastor Zach Sorovic is a young, dynamic pastor, and he's going to tell you and teach you how you can recover and overcome weaknesses. Because we want to be defined by overcoming our weaknesses,
Because
not by
you know
the
what?
weaknesses.
Physical and mental and emotional health only goes so far.
The
You
whole
know,
body.
it involves the most important aspect of all of them is this intertwining spirituality, and Pastor Sorovic is going to be looking at that. So I think even if you can't come during the day, 6:30 at night. You're not going to want to
That's
miss
right.
it, right?
Beautiful.
And
Beautiful.
Pastor Sorovic too, Pastor Zach. We call him Pastor Zach affectionately. He is young and he brings in new concepts like social media, internet, and things. He's an exciting speaker, and he's very relevant to this community.
So again, even we want you to come during the day, but if you can't come during the day, come at 6:30 at night.
Hi, caller. Good evening.
Good night to you, sir.
Hi, your
Good
TV.
night, and good night to your panel.
Yeah, and turn down your TV. V.
All right. I have a dozen things to ask about, but
A dozen?
I'll do one.
Yeah, just one.
I'll do one. Most times, like night or sometime in the day, my nostrils, they get blocked up. And there's a thing they call deep sea,
Do you have polyps?
I'm trying to see the name.
Did they diagnose you with nasal polyps?
Yes, no, they didn't, no, I haven't gone anywhere to find out, but I'm just wondering why my nostril is blocked at night. And when I do a squirting, I squirt a little bit of DC, something you inhale. You squirt a little in your nose, and a little after that, it clears up.
Is it so? It's only first thing in the morning, or
Yes,
all
it's
during
not-
the
no,
day?
It comes on anytime. Like, I'm talking to you now, and it's 5 minutes after now it will come on, and when I squeeze this thing into my nostrils,
You
just clears up after. But I'm wondering why that is happening.
You could have allergies, seasonal allergies. So what I would recommend is why don't you come in, we'll evaluate you. We have wonderful medication that we can help you with, but even better than the medication, we have all kinds of wonderful ideas to help you with lifestyle changes as well. So we want to
Well,
see
I'm
you.
following the program, and I think I understand where I have to come.
Great.
And I'm hoping when I'm coming, I can walk with that gentleman who says that he doesn't know.
You're making fun of me. You're making fun of me. It's okay. It's all good. It's all good. Thanks for calling.
Thank you very much.
You will.
Okay.
God bless you.
Bye-bye.
21st.
Yeah, bye-bye. God bless.
Bye. All right, good. This is good. Now, Doc, a lot of people, and I'm glad that you guys will be looking at this thing holistically, because health is about holistic living.
Amen. That's right.
And in Guyana, all over the world, however, Guyana, as Guyanese, sometimes we don't have the information to help us to live well. We have the fruits and vegetables and stuff like that. However, we don't have the information. So it is good that you guys are coming, and Pastor Zach, I know he'll do justice in combination with what you guys are doing. You saying like you could sing. Are you going to be doing some specials for that?
Yeah.
You know,
Do you sing, Leela? You have a nice
yes, I used
singing
to sing.
voice. Used to, but you're singing Guyana. Nobody would know
That's
except
right.
those who
if
record
I sing, they
you.
won't come.
we do have. You guys are
I know
funny.
you have a team.
Well, we do have a wonderful team. They're going to be wonderful musicians. We're also having a team of people, not just Pastor Zach. We have been doing the spiritual health, but another team that's going to be doing the physical, the mental, and emotional healing.
And let's not forget the program we had for kids at night.
I did. I was going to
Absolutely.
say children's
A full
story,
children's
and that they're going to have
program.
their own little
They
thing.
have their own, so
Beautiful,
mom and dad
beautiful.
can
Bring
go
the
in.
children,
They can
yes.
learn about whole person
Yes,
care, and the
yes,
babies are all
yes.
taken care
They
of.
can do crafts and things.
Beautiful. Oh, we're at the top of the hour. I'm gonna ask the technician to just give us a couple more minutes. Let me take 2 more calls. Hi, good evening.
Good evening.
Quick.
I'm Trump. Went to the doctor with some test pain to say I have a sinus heart. What is that?
A what?
What?
A sinus heart.
Oh,
Oh,
sinus
sinus
arrhythmia.
tachycardia.
Yeah. You probably have a problem with your heart. So please come in and we can listen to your heart. We don't have a capability of doing an EKG, but we can at least examine you and bring your EKG results in.
Okay, let me take another caller. So come. Final caller. Hi, good evening. Hello?
Hello.
Quick, turn on the TV.
Hello.
Turn on the TV. Take a minute, put on the
Can
phone.
I-
Turn on the TV.
You have to turn down the TV, man.
Hello.
There you go.
Good.
I know which night would be the program.
Every night, starting on the night of the 18th, 19th, 20th, and 21st. We're not going to be there on the 22nd. We're taking a
So which night would be the young pastor?
Every night.
Every night.
Okay, thank you then so much.
Thank you.
Okay, beautiful. All right, folks, thank you so much. Finally, just a closing thing from both of you, and then we wrap up.
Why don't
Just
you go first?
a closing thought, Leila.
Well, just we want to see you come out. You know, God created us as whole beings, physically, mentally, emotionally, and spiritually. And that's our goal, to be able to treat the whole person. So God bless you, and we look forward to seeing you.
Thank you, Dr. Troy.
And we, Dr. Layla Lewis and I, really came out here because we just wanted to show you how much we love you. And so, whatever we could do, we may not have all the answers, but I'm going to tell you the truth. We worked real hard to be here, to bring you lots of equipment and opportunities to see if we can help you. But honestly, we give you ourselves and our training and our medical expertise, and we'd love to share that with you and to show you that we love you. And we want to show you a way to better life, not only for health, but also for spiritual and physical healing as well.
Beautiful. Thank you so much for tuning in. We completely out of time. Next week, we'll continue with the happiness program. Have a great Sabbath for those of you who keep the Sabbath. For the rest of you, have a wonderful weekend. See you next week, 8 o'clock, the same station. God bless you. Bye-bye.